Millions of seniors wake up every day in pain. But what if you could change that in just a few minutes each morning? If you're over 60 and living with arthritis, you know that moment when your body wakes you before your mind is ready. You try to stand, and your knees or back feel like they're locked in place before you even begin the day. That sharp ache, that dragging stiffness, it's real, and it's powerful. You're far from alone. In recent years, nearly 54% of U.S. adults aged 75 or older have been diagnosed with arthritis, and the number climbs steadily with age. That means more than half of our neighbors, our friends, or perhaps even you, are greeted each morning not with ease, but with a daily reminder of pain. It's no surprise that nearly 70% of adults between 50 and 80 report joint pain, with about half saying it limits their daily activities. Imagine waking up and feeling drained, not because you did too much yesterday, but because your own body hasn't yet forgiven the night. That sense that even simple actions could hurt, that mornings shouldn't feel this heavy. But let me tell you something important: you still have hope, and healing doesn't have to be complicated. You don't need to reach for pills or expensive treatments right away. What if I said that just 5 gentle, natural steps each morning could soften that stiffness, ease inflammation, and gradually help you reclaim comfort? In this video, I'll walk with you through those 5 easy habits. We'll explore why they matter, how to do them safely, and how to build them into your morning so you can feel just a little better today and every day after. Let these habits be a quiet promise not to erase aging, but to support it kindly and thoughtfully. If this feels like the kind of guidance you need, I'd be honored if you subscribe. We'll keep building this gentle path forward together, one simple step at a time. So now that we've acknowledged the pain that mornings can bring, let's take the first real step toward feeling better. Starting with something so simple, it's often overlooked: hydration. You've likely been told to drink more water, but when you live with arthritis, this habit carries a deeper meaning. And for joints that are already inflamed, this makes everything feel tighter, drier, more painful. Joints rely on fluid, specifically synovial fluid, to cushion and lubricate movement. But when you're dehydrated, that fluid becomes less effective, like trying to oil a hinge with dry dust. Rehydrating first thing in the morning isn't just a healthy habit, it's a direct message to your joints. I'm here to support you. But we can go even further than water. One of the easiest ways to add natural anti-inflammatory power to your morning is with warm lemon water. It's gentle on the stomach, and the vitamin C in lemon plays a key role in collagen synthesis, which helps maintain the integrity of cartilage, the flexible tissue that protects your joints. Some research has shown that antioxidant compounds in lemon may also reduce inflammatory markers in the blood, especially C-reactive protein, which is elevated in many people with arthritis. I remember a patient in her late 62nd who began drinking lemon water daily, initially for digestion. Within weeks, she noticed her fingers felt less stiff in the mornings. That small change was meaningful. When we support the body's natural anti-inflammatory processes, results often show up in simple but noticeable ways. And then there's ginger tea, a quiet powerhouse. Ginger contains compounds like gingerol, which have been shown in multiple studies to inhibit the same inflammatory pathways targeted by some NSAIDs, but without the side effects. A randomized double-blind study published in Arthritis and Rheumatism found that patients with osteoarthritis of the knee who took ginger extract experienced significant reductions in pain and improvements in movement over 6 weeks. Another excellent option? Turmeric tea, particularly when combined with a pinch of black pepper to enhance absorption. The active compound, curcumin, has been shown to reduce joint swelling, stiffness, and inflammatory cytokines. One study in the Journal of Medicinal Food found that curcumin was as effective as ibuprofen in relieving pain among patients with knee osteoarthritis without the gastrointestinal issues. Even adding just one of these drinks to your morning lemon water, ginger tea, or turmeric tea can begin to shift the inflammation response in your body. And when done consistently, you're not just quenching thirst. You're laying a gentle foundation for your joints to move with greater ease. It may sound simple, but simplicity is often where healing begins. Hydrating in the right way each morning is a quiet but powerful step one that tells your joints, I see you, I care for you, and I'm giving you what you need to feel better today. In the next part, we'll go deeper, not into the body, but the mind. Because healing doesn't stop with what you drink. It also starts with how you breathe. After nourishing your joints with healing hydration, there's another part of your body that deserves just as much care, to your mind. You see, arthritis doesn't just live in your joints. It has a way of creeping into your thoughts. The daily discomfort, the unpredictable flares, the fear of pain returning, it all adds up. And over time, that physical pain begins to carry emotional weight. What many people don't realize is that stress and chronic pain are deeply connected. When you're tense, your muscles tighten, your nervous system becomes hyper-alert, and your brain, sensing danger, can actually increase your perception of pain. It becomes a loop. Pain leads to stress, and stress makes the pain feel worse. But there's a way to interrupt that cycle, and it begins with something as basic as breathing. Mindfulness and deep breathing exercises aren't just trendy wellness tips. They have real, measurable effects on how your brain processes pain. Studies using functional MRI scans have shown that people who practice daily mindfulness have lower activity in brain regions associated with pain perception. Even a few minutes a day can lower cortisol, the stress hormone that contributes to inflammation, and activate the parasympathetic nervous system, which helps your body rest and repair. And the best part? You can start right now, right where you are. Sit in a comfortable position. Close your eyes if you'd like. Now breathe in slowly through your nose for a count of 4. Hold it for 4. And gently exhale for 4. This is called box breathing, and it's been shown to help calm the nervous system and reduce physical tension in the body. Some of my patients begin their day with just 2 or 3 minutes of this practice before their coffee, before checking their phone. One woman told me that simply starting her day with breathing helped her feel more in control, more centered, even when her joints still ached. The pain didn't disappear, but the panic around the pain did. And that made all the difference. If you prefer guided support, there are many short mindfulness audio tracks designed specifically for arthritis and chronic pain. These aren't about positive thinking or pretending you don't hurt. They're about grounding yourself, building mental resilience, and creating space in your day where pain doesn't get to be the boss. The body follows where the mind leads. And when your morning begins with even a few minutes of quiet presence, your whole system, joints included, feels that shift. In the next part, we'll gently move from the mind to movement itself. Because once you've calmed your nervous system, your body is better prepared for one of the most powerful tools we have against arthritis pain: motion. Once your mind is calm and steady, your body becomes more ready to move, and that's exactly where healing deepens. Now I know when you live with arthritis, the idea of movement can sound more like a threat than a solution. Maybe you've been told to stay active, but what no one explained is how difficult that feels when just standing up can hurt. Many patients have told me, "Doctor, how can I exercise when my joints scream at me every time I try?" But here's the truth. Motion is medicine, especially for arthritic joints. The key is to choose the right kind of movement. Low impact, gentle, and consistent. Let's break it down. When you move, even lightly, you stimulate blood flow to the joints. That increases oxygen and nutrient delivery to the cartilage, the tissue that cushions your bones. It also activates the circulation of synovial fluid, which is like nature's joint lubricant. Without movement, this fluid becomes sluggish. But with even just a few minutes of gentle activity, you're helping your joints stay nourished and flexible. Take walking, for example. A recent review in the Journal of Exercise Rehabilitation found that just 20-30 minutes of walking, 5 days a week, significantly improved joint stiffness, mobility, and quality of life in adults with osteoarthritis. And you don't even need to leave your home. A few minutes of walking in place or down your hallway counts. Prefer something even lighter? Try slow leg lifts, shoulder rolls, or standing knee bends while holding onto a chair for support. And if you're lucky enough to have access to a warm pool, Water-based movement is incredibly joint-friendly. The buoyancy reduces pressure on your joints, while still giving your muscles and connective tissue the work they need to stay strong. One of my patients, Harold, age 72, told me he began with 5 minutes of walking each morning, barely making it to the mailbox and back. But he stuck with it. After a few weeks, he could circle the block. More than the physical progress, he told me, was the emotional boost. I finally felt like I was doing something for my body instead of just surviving in it. And that's exactly the mindset shift we're aiming for here. Light movement each morning is not about burning calories or pushing limits. It's about waking up your joints with kindness. It's about reminding your body that it's still capable of healing, even if the process is slow. If you're starting from zero, that's okay. Even 3-5 minutes of slow, mindful motion each morning can begin to change how your body feels by midday. The more consistent you are, the more your joints will learn to trust movement again. And now that we've activated the body from the outside, in the next part, we'll focus on the inside, looking at the small but powerful nutrients that can help support joint repair and calm inflammation from within. Now that your body is gently in motion, there's one more layer of support we can offer your joints from the inside out, and that comes in the form of the right supplements. I want to be very clear here. Supplements are not magic pills. They won't erase arthritis overnight. But when used properly and consistently, they can help reduce inflammation, nourish your joints, and support your body's natural ability to heal. The most well-known, and perhaps most researched, is omega-3 fatty acids. Found in fish oil or algae-based capsules, omega-3 second have strong anti-inflammatory properties. They work by inhibiting the production of inflammatory molecules called cytokines and prostaglandins, which are elevated in arthritis. In a 2020 meta-analysis of 20 randomized controlled trials, omega-3 supplementation was shown to significantly reduce joint stiffness and tenderness in people with rheumatoid arthritis. Another important supplement is glucosamine, often combined with chondroitin. These compounds are naturally found in healthy cartilage and are believed to help slow cartilage degradation, especially in osteoarthritis. While the research has shown mixed results overall, some studies, like one published in The Lancet, suggest that long-term use may reduce joint space narrowing and improve mobility in the knees. Many of my patients report that while the effects are not dramatic, they're noticeable over time. And of course, there's curcumin, the active ingredient in turmeric. If you've already added turmeric tea to your mornings, you're off to a great start. But supplementing with a concentrated curcumin extract, especially one combined with piperine, black pepper, can deliver therapeutic anti-inflammatory benefits. One clinical study published in Phytotherapy Research found that 500 mg of curcumin taken twice daily was just as effective as ibuprofen in managing pain from knee osteoarthritis, but with significantly fewer digestive side effects. Now, here's the key point I always share with patients. Check with your doctor first. Supplements may seem harmless, but they can interact with medications or affect underlying conditions. A quick conversation with your healthcare provider can help you choose the right type, dose, and timing based on your unique needs. And if you're someone who struggles with remembering to take pills, try placing your morning supplements near your breakfast setup or next to your teacup if you've started your day with lemon or turmeric tea. It's a small habit, but when it becomes part of your routine, it can support long-term joint health in a meaningful way. One of my patients, Marcus, a retired school principal in his late 60s second, began taking a combination of omega-3 second and curcumin daily, along with morning walks and better hydration. He told me that after a few months, the sharp edge of his knee pain had dulled. I didn't feel brand new, he said, but I felt like I had a little more control, and that gave me hope. And that's what this is really about, not chasing a cure, but creating a routine that builds resilience. Next, we'll return to where many of us begin our mornings, in bed, and I'll show you how just a few minutes of gentle stretching can help unlock stiffness before you even step into your day. After fueling your body with the right nutrients, there's one final habit that ties everything together, and it begins before your feet even touch the floor. I'm talking about gentle morning stretches, not exercise, not yoga, just slow, simple movements to ease your joints into the day. If you live with arthritis, you already know that mornings are often when stiffness feels the worst. That's not just your imagination. During sleep, your joints are inactive for hours. Circulation slows down. Synovial fluid, the lubricant your joints rely on, settles and thickens slightly. So when you wake, your body needs time to get things moving again. Stretching gently in the morning helps restore mobility, encourages fluid flow around the joints, and reduces muscle tension. Think of it as warming up your body, the same way you might gently stir a pot before bringing it to a boil. And you don't need a long routine or fancy equipment. Here are a few stretches I often recommend to patients. Start with wrist circles, especially if your arthritis affects your hands. Extend your arms in front of you and slowly rotate your wrists, 10 seconds in each direction. It's a small move, but for many, it makes daily tasks like brushing teeth or holding a coffee mug easier. Next, shoulder rolls. Lift your shoulders gently toward your ears, then roll them back and down in a circular motion. This helps release overnight tension in the neck and upper back areas that often tighten from sleeping positions. For the spine and hips, a seated twist works wonders. Sit upright on the edge of your bed or chair. Place one hand on the opposite knee and slowly twist your torso to the side. Hold for 10 seconds, then switch sides. This stretch gently activates the core and helps loosen stiff lower back joints. If your legs feel tight in the morning, a simple hamstring stretch can help. Stand up, extend one leg slightly in front of you, heel down, and gently bend your opposite knee while keeping your back straight. You should feel a stretch along the back of your thigh. Hold briefly, then switch sides. The key to all of this is gentleness. You're not pushing through pain. You're meeting your body where it is stiff, maybe sore, and guiding it, little by little, toward relief. One of my older patients, Ruth, told me she used to dread mornings, but once she added a 5-minute stretch routine just before making her tea, she began to feel less trapped in her body. It was the first thing I did for myself each day, she said, and that made it easier to keep doing the rest. That's exactly the point. These habits don't work in isolation. They build on each other. A warm drink, a few quiet breaths, a slow stretch, all of them signal to your body, you're safe, you're supported, you can move today. And now, as we prepare to bring it all together, let's look at how these small changes done consistently can become the foundation of a routine that helps you move through life with less pain and more peace. So now we've arrived at the end, but truly, this is just the beginning. What we've explored together isn't a treatment plan. It's not a cure. It's something quieter, something more powerful in the long run. A routine. A small collection of morning habits that work together, gently and consistently, to reduce stiffness, lower inflammation, and help you feel more like yourself again. Let's take a moment to remember what those habits are. You start with hydration, warming your joints from the inside. You take a few minutes to breathe and quiet the mind. You get your body moving, not with force, but with care. You nourish your joints with supplements that support repair. And you finish with gentle stretches, unlocking the stiffness that once held you back. These steps may seem small on their own, but stacked together, repeated daily, they create a rhythm that supports healing. A rhythm that says, I'm not giving up on myself. Healing doesn't have to be dramatic. Sometimes it looks like being able to stand without wincing, or walking a little farther, or just getting through the morning without feeling defeated before the day even begins. And if you're still here with me, I want to say thank you for your time, your trust, and your willingness to care for yourself in new ways. You didn't have to stay, but you did. That tells me something important. You're ready to shift from managing pain to rebuilding control. I hope you'll take one or two of these habits and begin tomorrow. Not perfectly, not all at once, but gently. If this video spoke to you, I'd be honored if you'd subscribe to Golden Health. It helps us reach more people like you seniors who deserve to feel stronger, more supported, and less alone. Until next time, take Take care of your joints, your breath, and your mind. You deserve to feel better not someday, but starting now.